Hey, beautiful people. Recently, we had some new cholesterol guidelines that came out from the American College of Cardiology and the American Heart Association. There's a lot of talk about numbers, and we need to know what these numbers actually mean, what changed, or what you should be doing differently because of it. And listen, although the conversation might get a little muddled in some circles, cholesterol and its associated markers are still associated with increased risk of heart disease. And globally, heart disease is the number one killer of us humans, okay? And for us, black and brown people, it actually impacts us earlier in life and with higher mortality rates. So this is important, okay? Today, we're breaking it all the way down what cholesterol actually is, what your numbers mean, what the new guidelines say, and what changed, and what actually works to lower your risk. We ain't gonna get too confusing, no overwhelm, just some clarity, okay? So, welcome back to Well with Mika, where we talk real wellness for your real life. I'm Mika, your cultural wellness ally, and let's get into this cholesterol conversation. We're going to start simple, okay? What is cholesterol? Cholesterol is a waxy, fat like substance your body uses to build cells, make hormones, and produce vitamin D. Your liver makes most of it, like 75% of it. So, cholesterol itself is not bad. The issue is how it's being transported in your blood. Now we have the different types, right? What you'll normally see is your LDL, your low density lipoproteins, right? Or lipoproteins, however you want to pronounce it. This is the one that we definitely want to lower. LDL, it carries cholesterol to your arteries where it can build up and form plaque, and that's what raises your risk of heart attack and stroke. And also, a quick note, because this is something that you might not hear too often or you might have heard mentioned, but you don't know how it fits in. There's something called apolipoprotein B or ApoB, right? And that's a protein that's found on particles that carry cholesterol, like your LDL. So instead of just measuring how much cholesterol is in your blood, ApoB tells you how many actual particles are circulating there. And in some cases, that could give a clearer picture of your risk. So if you want to go another level deeper with your labs, ApoB is a great conversation to have with your doctor. All right, so that's LDL and ApoB, right? Now we're going to get into your HDL, that high density lipoprotein. And this is where it's kind of changed over the years, right? Because HDL used to be that girl, right? The more the merrier. HDL is what carries the cholesterol away from your arteries back to your liver for removal. But instead of saying, oh, the more the better, now we say, and now what's known through the research is that is how well your HDL functions. And also, what's new is that extremely high HDL is not cause to celebrate. It may not be protective. It may even increase your risk in some cases, and its role actually varies across racial groups. And this is important for us to understand because research has shown that low LDL, which is considered a risk factor in white populations, doesn't predict heart disease risk the same way in black adults. So those ideal numbers that you might see, they don't always tell your full story. So we're no longer just chasing high HDL as the goal. So that's something to keep in mind as you have these conversations with your primary care again. I will always say that because you have to have these conversations with your primary care. Now your triglycerides. What's triglycerides? Because you always, when you see your blood work in your panels, it's your LDL, your HDL, and your triglycerides, right? And this one gets skipped in the conversation a lot. Triglycerides, they're a type of fat in your blood that your body uses for energy. But when they're elevated, that's when you get your risk of increased risk, of heart disease, especially if you combine that with a high LDL or a low HDL. So your triglycerides are strongly influenced by things like excess sugar, your refined carbs, alcohol, low movement. So if LDL is the main driver, triglycerides are often the lifestyle signal. So if your labs come back off, sometimes it's not really a mystery. It's that It's that late night snacking you're doing, you eating ice cream in the middle of the night, you drinking a shake. We gotta chill. The I'll start Monday cycle, that's something that can actually contribute to a negative triglyceride level. And that's something you could shift. That's something you have full control over. So we're going to just pull this all together. The quick summary is that your LDL, you want that lower, right? Your HDL, you're not going to obsess over a number, over the high number. You just want to make sure that, that's not too low, but you don't even really want to obsess over that number. And then your triglycerides, you definitely want to watch your lifestyle patterns as it pertains to your triglycerides. Okay? Low LDL, I'm sorry. HDL, we're not going to be obsessive, and triglycerides, watch your lifestyle patterns and keep that low as well. Now let's talk about what actually changed, because this also matters. Now they're looking at long-term risk. It used to be a 10-year window, right? Because everything was based on this 10-year risk window. But now the guidelines say to look at a 30-year risk window. So that just means you might be fine right now, but still on track for problems later. So the focus is shifting to earlier prevention, not a late reaction. Then number two, clear LDL targets. The numbers say over the general population, we want to have LDL below 100. For the higher risk population, below 70. Existing heart disease, we want below 55. And that's huge because, now you know exactly the target that you're aiming for. And then this is a big one for families. What they're doing now is earlier screening. So kids between the ages of 9 to 11 are going to be screened. Again, you're going to get those screenings between the ages of 17 to 21, that late adolescent period, and then again every 5 years in adulthood. Why is this happening? Because some conditions are genetic, and catching them early can change everything, okay? Then there's this new tool called Prevent. It's a risk calculator, right? Now the guidelines now recommend that that I told you the calculator is going to do your risk assessment. So it's a risk calculator that estimates your 10-year risk and your 30-year risk. So it uses things like your cholesterol, your blood pressure, diabetes status, smoking, and those things together are powerful because it will help to really steer the conversation with your doctor and not just react to one particular number. You'll have a better overall picture of what your risk factors add up to, okay? And then we can't leave lipoprotein A out of the equation, because this is the test that you're not really offered by your doctor, but you should know about it and ask for it, okay? Especially for our community, because studies show that people of African descent are significantly more likely to have elevated LPAs, your lipoprotein A levels, which can increase your heart disease risk, even when your standard cholesterol numbers look normal. So this is one of those tests that could really fill in the gaps. What lipoprotein A is it's a genetic cholesterol marker, and like I said, it significantly increases your heart disease risk. So you only need to test it once because it's largely genetic, okay? And it doesn't change much after early adulthood. So, you want to be really tuned into the fact that you should bring this up with your doctor, because they probably won't bring it up to you. And this is why conversation matters even more in our community, because Black women, for example, have some of the highest rates of heart disease and stroke, yet we're often underdiagnosed or diagnosed later. So understanding your numbers, having these conversations, knowing what to ask for, it's not just, oh, it's a nice to have, it's helpful. No, this is protection, okay? This is protection, this is help, this is mortality. So we have to bring these things up. Now let's get into the real solutions, all right? Our supplements are going to come into the conversation. And I have to be honest with you, because this actually surprised me too. When you really look at it, supplements, unfortunately, they're not the star of the show. Unfortunately, it is what it is. Fish oil gets brought up, okay? And when you deal with fish oil, when you're talking over the counter versus prescription, that's really the conversation that needs to happen. Because if you look, usually it'll say fish oil doesn't make a difference. Now, over the counter fish oil does not make a difference, but this is where the nuance matters because, yes, there's weak and inconsistent evidence for over the counter fish oil, but prescription fish oil, like high dose EPA, that's actually clinically shown to lower your triglycerides significantly. So it's not that omega 3s don't work necessarily, it's that dose and the quality matter. Now, what does work? Food works, okay? We're talking soluble fiber. 5 to 10 grams per day can lower your LDL by 5 to 10%. So those foods include oats, beans, lentils. This one we talk about that fiber, and I know the conversation of fiber maxing has happened. That is very good for lowering your LDL. Then you get into your healthy fats. You're talking nuts, your olive oil, your avocado. Those are very good for your cholesterol levels, and your fatty fishes like your salmon, your sardines, your mackerel. Real food over the pills and the supplements, okay? Movement. We gotta add in the movement, right? Exercise helps, but we have to be clear about how it helps. It's not the strongest lever for your LDL lowering, but it does raise your HDL, it does lower your triglycerides, and it improves, of course, your heart health overall. So your goal is you want 150 minutes per week of that moderate intensity aerobic exercise. Okay, that's the goal. And that includes, your walking, your dancing, whether it's in your kitchen, your living room, a class, anything that you can do consistently. Now, when is medication needed? We got to talk about the statins, okay? Statins do work. I am not, and most of us, well, I can't say most, but some of us, right? We don't want to run to prescription meds if we don't have to. But the research shows that statins do lower your LDL by 30 to 50%. That is huge. So sometimes you need them, because your body, it might just it's making most of your cholesterol. So if your liver is overproducing that, lifestyle changes alone may not be enough. And it's not a failure on your part. That's not a individual lifestyle issue. That is just your biology. So you just have to work with what you have, all right? Don't feel bad about it. Just take the necessary steps to fix it and mitigate whatever problems might come from it, all right? Now, what do we do next? Number one, you have to get your labs done. Get your physical every year, please. You ask for your lipoprotein A or your ApoB numbers to be included in there. Ask them to run those tests. Use the prevent calculator. Check and see what your risk factors are. Add fiber daily. Move consistently. Have real conversations with your doctor, especially because we know that the system hasn't always been designed with our bodies or our data in mind. So you have to have these real conversations with your doctor. And when you talk to your doctor, be conversational, be curious, be honest, but don't be passive. Advocate for yourself, ask the questions, push for clarity. This is your body, okay? I want you to know that this is about knowing what matters so you can make decisions with clarity and not the confusion. It's awareness that leads to the right action. You don't want to just outsource your understanding of your body. Learn enough to ask better questions, okay? You're not just a patient. You're a collaborator. You're a participant in your health, all right? The more you understand your body, the more power you have over your future. So I hope that this helped you in some way to understand this cholesterol picture. Thank you for being here with me today on this Well with Mika episode. If this helped you, please share it with someone, like it, subscribe to the channel so that we could get into more of these health conversations, okay? Let's talk in the comments. Tell me, do you have a doctor that you can have real conversations with? Do you feel like you are a collaborator and a participant in your health, or do you just go and take in the information? Let's have this conversation. Is some cholesterol something that you even think about? Did you learn anything new? Okay, let's talk in the comments, all right? And I'll see you in the next episode. And as always, happy healthing. Peace.